Hello. Um, the final presentation of the conference today is absolutely one of the most important because we are going to present the first annual Immunize Virginia Award for Outstanding Contributions for Immunization Advocacy. And I want to invite my colleague, Dr. Mike Martin, who is the chair of the Immunize Virginia Advocacy Work Group. He's a member of the steering committee and the president of the Virginia chapter of the AAP, and also my friend, to take forward, introduce the award, and our winner. Mike?
Great, thanks, Carolyn. Thanks to you, Rebecca, for all putting this all together with her staff, and it's been awesome. So I really appreciate it, and I think everyone does. So as Carolyn says, this is the first annual ImmunizeVA Award for Outstanding Contributions to Immunization Advocacy. It's going to be an annual tradition that we're going to continue for many years to come to recognize those whose work promotes needed and important vaccines that benefit the citizens of our Commonwealth. Over the past year, we have definitely been reminded time and time again of the importance of vaccines to keep some of the deadliest diseases at bay, none less than COVID. And we've also been reminded of the importance of strong advocacy and strong policy to combat misinformation and ensure the protective vaccines are available to everyone, regardless of one's color of skin, where one lives, their immigration status, gender, or their beliefs. There's now a battle underway between science and information. And more than ever, we need to recognize champions who are strong enough and brave enough to publicly defend the importance of vaccines for the good of all Virginians. So on that note, it's my pleasure to present the inaugural award to such a person who rose to the call for help to champion immunizations this past year. This year's award goes to Virginia Delegate Rodney Willett. And Delegate Willett is a Virginia native who graduated from the College of William and Mary, where he earned both his undergraduate and his law degrees. As an attorney, Rodney represented local governments in Virginia, where he learned firsthand what good governance can look like and the positive impact it can bring to working families. Rodney was elected to the House of Delegates in 2019, and there as a delegate, he represented the 73rd District. He helped pass laws improving Virginia's early childhood educational opportunities, adolescent mental health programs, and environmental protections. He's honored to serve as a chair of the Behavioral Health Subcommittee, in addition to his position on the Health, Welfare, and Institutions, Finance, and Agricultural committees. In addition, he's serving others in his professional career as an elected official. Rodney also volunteers on numerous boards and committees. This year, Delegate Willett introduced Health Bill 2061 that will require for the very first time in Virginia that all immunizations given in Virginia by health providers will be recorded in the Virginia Information and Immunization System, or VIS. This really sets the foundation of our work to ensure we more accurately target our vaccine advocacy to where the actual gaps in vaccine coverage are. And from this data, will come our marching orders as an organization. And while Delegate Willett definitely innocently dipped his foot into the waters where the anti-vax community swims regularly, he never wavered and stood his ground for what he knew was good for the Commonwealth. Delegate Willett, thank you for your resilience to stand strong for the science and truth of vaccines and how they save lives. And I give you this year's award winner, Delegate Rodney Willett.
Mike, thank you so much for the introduction, but more importantly, thank you for your advocacy. Again, I certainly carried the legislation and was an advocate myself, but there's no question we would not have this bill, we would not have this law now without your work, as well as that of the Virginia chapter of the American Academy of Pediatrics. You stepped up, identified this issue, which I didn't even know about. I didn't realize that the gap we had in this reporting, and once you made us aware of that, no, this is something we need to address, and certainly getting you taking advantage of the VIS the system that's in place absolutely made sense. And to that point, how this made sense, there was wide, very broad bipartisan support for the legislation. I think everyone realizing, this is something we need to do and take advantage of. And really just because of the consequences of it, when you have folks who could be either over vaccinated or more likely maybe under vaccinated, especially as mobile as people are today, this really was a need that needed to be filled. Also want to thank Lauren Schmidt from the Commonwealth Strategy Group who worked with us on this, and really a thank you to those of you on joining the conference today, because you are absolutely frontline in dealing with the pandemic and the amazing circumstances you're operating under. We have a solution, at least almost perfect solution to this issue in terms of vaccinations, in this case of COVID. And as has been discussed today in the conference, that there are still barriers there. But thank you for your perseverance and doing the best you can to get people to take advantage of this vaccine, and then more broadly all vaccines. I mean, there's so much work has been done in this area. We can keep people safe. We can keep people healthy because of all this work, and so we just need to identify that, and then now also track that better through this reporting. So I look forward to continuing to work with you in the future. I was able to listen to some of the earlier presentations, and this has just been a great discussion today. So thanks for enabling me to do that, or allowing me to do that as well. And again, I really look forward to working with the medical community because there are going to be additional issues we need to address. And I absolutely want you at the table with me because you are the providers and the folks who know how to take care of Virginians, and I absolutely want to make that happen. So again, thank you very much. I'm so honored and really, really enjoyed being with you here today.
Okay, Delegate Willett, this will be, I don't know if you can see, but this will be
cool.
the award we send you, and it was handmade by my chairman down here at Eastern Virginia Medical School, Dr. C.W. Goins. So we'll get this mailed up to you, but it's just a small token of the appreciation both the chapter and Immunize Virginia and all Virginians have for you. So we'll get this to you, and hopefully you will display it in good health. But thank you so much for everything you do for us.
Oh, thank you. That means so much. That is wonderful. Thanks for holding up on the screen there. That's absolutely beautiful. And thanks again.
Thank you. Thank you.
Thank you.
Okay. All right.
Well, thank you so much. We know you have to run, Delegate Willett, but we'll be in touch, and we really appreciate all your work.
Okay. Thanks, everyone.
Bye.
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 All right.
Bye, Mike.
Well, with the few members of ImmunizeVA we have on screen, we just wanted to sincerely thank you for being here today. You will receive an email after the meeting with information about continuing education credits if you are interested in those. The event space will stay open for about 15 minutes following till about 1:15, where you can continue to network, chat with each other, meet in the networking space. Please feel free to reach out to us if you would like to learn how to become a member of ImmunizeVA and help plan and shape future meetings like this. But with that, those few housekeeping notes, I'm going to turn it back to Carolyn to say our closing words and wrap us up for the afternoon.
Okay. Thank you all again for being at our first conference. We hope this will be one of many. Who knows, one day we might be able to get together and actually network in person. And who knows, Tracker herself may show up. But in all seriousness, thank you for everything you do. And I want to especially thank Alyssa Wong and the Professional Education Work Group, because these folks have worked so hard putting this event together. And I think we've had a good broad range of speakers. And as Rebecca said, you can get back with us and give us your feedback, as well as suggestions for future conferences and all. But thank you mostly for doing what you do every day in your jobs under extraordinary circumstances to get shots in arms of Virginians. So thank you. And I'm going to release you into hopefully a wonderful weekend. Thank you.
And Carolyn, I just also wanted to say thank you from the bottom of our hearts. You did so much work to prepare for this meeting, and that work has not gone unnoticed. So if everybody from wherever you are joining us can clap for Carolyn and everyone who was involved in planning this. Our steering committee, Alyssa, and the professional education work group, it's been a monumental effort. So truly, Carolyn, congratulations. If Tracker were here, she'd be wagging her tail. You did it. All right. Thanks, everyone. We'll see you soon.